Welcome to Health Bulletin. We turn our focus to a developing health crisis in the Democratic Republic of Congo, where an unidentified illness is causing significant concern. The latest update from World Health Organization, so far 419 cases and 53 deaths have been reported in two villages, Boloko and Bomate, in the Equateur province. The outbreak began in Boloko after 3 children consumed a bat and died within 48 hours, with symptoms resembling those of hemorrhagic fevers. However, tests have since ruled out Ebola, Marburg, and COVID-19. Medical experts, including Serge Ngalibato, the medical director of Bikoro Hospital, note that the rapid onset and high fatality rate, in fact in many cases result in death within just 48 hours, is particularly concerning. As we all know, bats are known carriers of numerous viruses, including Ebola, Marburg, and SARS-CoV-2. Although these have been ruled out, so the possibility of a new or unidentified virus remains. And recently, Chinese renowned researchers Batwoman Shi Zhengli discovered HKU5-CoV-2, a bat virus capable of infecting humans at the Wuhan Institute of Virology. Could this be related? As Mabeka virus group, like HKU5-CoV lineage 2, which has the potential to infect humans through AC2 receptors, similar to SARS-CoV-2, which caused COVID-19 pandemic, as she mentioned in her paper which published in Cell early this month. So further research is needed to determine if such a virus is involved here. This outbreak comes at a time when zoonotic and vector-borne diseases remain a global challenge. While some cases previously in the region have been linked to malaria, the unknown nature of this illness adds another layer of complexity. Not only that, the recent policy shifts under the Trump administration, most notably the withdrawal from the WHO and freezing US aid, have raised concerns about weakening global disease surveillance and response capabilities. This developing crisis in the DRC underscores the critical need for robust international cooperation and investment in public health infrastructure. As scientists continue to investigate the source and nature of this unidentified illness, it is clear that global vigilance remains essential. Meanwhile, in Trump's first cabinet meeting, Elon Musk acknowledged that the Doge team had accidentally cancelled an Ebola prevention program only to reinstate it later. This admission highlights the critical role such programs play in preventing future pandemics. Programs like these, often funded by USAID, are vital for disease surveillance, prevention, and response in vulnerable regions. The mystery illness in Congo is not an isolated case. Similar outbreaks have been reported in other corners of the world, from Asia to South America. These incidents underscore the interconnected nature of global health and the need for robust, coordinated responses. As the world grapples with COVID-19, Ebola, and now mystery illnesses, investing in prevention and preparedness is more critical than ever. From Congo to Asia, mystery illnesses remind us that health crises know no borders. Another evolving health crisis is unfolding in Texas, where a measles outbreak has claimed its first fatality. The victim, an unvaccinated school-age child, was hospitalized in Lubbock. This tragic death shows the dangers of declining vaccination rates and the resurgence of a disease once thought eliminated in the US. So far, 124 cases have been reported, with most affecting children, highlighting the severity of this highly contagious disease. Measles can lead to life-threatening complications, including pneumonia and brain swelling. Measles was declared eliminated in the US 25 years ago, but due to anti-vaccine advocacy groups, have fueled misinformation, falsely linking the MMR vaccine to autism. This has led to declining vaccination rates, leaving communities vulnerable to outbreaks. Health officials are urging parents to vaccinate their children. During an outbreak, 1 in 5 people who contract measles will need hospital care, and 1 in 20 will develop pneumonia. Vaccination is the only way to prevent further tragedies. The measles outbreak in Texas is a stark reminder of the importance of vaccination. As we face this growing crisis, let's prioritize science, protect our children, and prevent the spread of preventable diseases. Subscribe Health Bulletin for the latest updates on outbreaks, scientific breakthroughs, and public health issues around the world.